published very recently, I believe. Well, I think I have some dates on there as well. So this was published about periodontal disease associated with breast cancer, especially in postmenopausal women. So published December 21st, 2015, so not even 6 months ago. Previous research has found links between periodontal disease and other cancers. So we wanted to see if there's any relationship with breast cancer. And this researchers, they found that among women, the risk of breast cancer was 14% higher in women who had periodontal disease, especially among women who had quit smoking within the past 20 years. Those with periodontal disease who had quit smoking within the past 20 years had a 36% higher risk of breast cancer. Why? Well, one possibility is that there's systemic inflammation with periodontal disease that affects the breast tissues. But another possible explanation is that the bacteria from the mouth can enter the circulatory system and they affect breast tissues. Periodontal disease and Alzheimer's. Historic evidence to support a causal relationship between spirochetes and Alzheimer's. Okay, so here is what they found. T. pallidum persists in the brain, sustains chronic infection and inflammation, and causes progressive dementia. It's noteworthy that the human oral cavity harbors more than 60 different Treponema species. Okay? These were previously considered as spirochetes or bacteria that don't cause problems, but several of them have been revealed to be predominant and invasive periodontal pathogens. So these pathogens are entering the blood and over time causing dementia and Alzheimer's. It's generally acknowledged that it is the invasion, the persistence, and the accumulation of T. pallidum in the brain which causes dementia. Periodontal disease in stillborn babies.
Looking at the camera, and now turn the other way.
It's not easy to be an actress, huh? How do we think beyond the possible? Here's one example. My research team thought outside the norm by asking the question how gum disease can cause premature delivery. A Eureka moment came when we discovered oral bacteria in a case of a woman who delivered at 24 weeks. Using a new DNA testing technology, we found an oral bacteria in her amniotic fluid, which matched with the bacteria in her mouth. This discovery demonstrates the importance of prenatal care and the impact of oral health on the entire body.
Okay, so we've known about this for a long time. Some of us, I shared this with many of you a few years ago, but the statement that in my mind is the most important by Dr. Yiping Han is that the testing suggested the bacteria was delivered through the blood. She's done other groundbreaking, incredible research that was published in 2013 about Fusobacterium nucleatum, which was the same bacteria that killed the unborn child. But she also found that Fusobacterium nucleatum potentiates tumor growth in colon and rectal cancers. And until now, it was unknown whether these microbes contributed directly to the formation of tumors, but they have determined that they do. And the statement that is most powerful to me here is we need to work effectively at reducing bacterial load in the colon and the mouth. So what we're learning from all of this, all of these things I've shared with you, just a few snippets. In our full perio program, we go through, I think, 38 different diseases and risks that exist from bacteria in the mouth. But with all of this, if you think, if you shared even just a fraction of what I shared with you now, when you're discussing the infection you see in your patient's mouth, does it help create a deeper level of understanding with your patient about why they need what they need? If we do that, you're not going to have your doctor writing, if the patient doesn't want quads, fine, on your whiteboard. We're going to have a higher level of understanding. And that's how we facilitate behavior change.